Hello everyone, this is Dr. Sayyam Shah and we are going to discuss the carotid triangle and a small related topic, the carotid sheath. We will start by looking at the boundaries. As this is a triangle, so naturally it will have three boundaries. Here we have the antero-superior boundary formed by the posterior belly of digastric, the antero-inferior boundary formed by the superior belly of omohyoid, and the posterior boundary formed by the sternocleidomastoid. Looking at the structures forming the roof or the structures above the carotid triangle, we have the skin, the superficial fascia, and the deep fascia. The superficial fascia contains the platysma muscle, the cervical branch of the facial nerve, and the transverse cutaneous nerve of the neck. The floor is formed by three structures: the middle constrictor muscle of pharynx, the inferior constrictor muscle of pharynx, and the thyrohyoid membrane. After looking at the boundaries, now we see what it actually contains. The contents of the carotid triangle can be divided into three subheadings: the arteries, veins, and the nerves. Firstly, the arteries in the carotid triangle are the common carotid artery and its two branches, the external carotid and the internal carotid artery. The veins, which include the internal jugular vein with its tributaries, the facial vein, lingual vein, and the pharyngeal veins. And the nerves, the 10th, 11th, and 12th cranial nerve and its branches are present in the carotid triangle. Here you can see the list. We have already discussed the arteries, the common carotid, internal carotid, and the external carotid artery, the internal jugular vein with its tributaries, and the nerves, the 10th cranial nerve, that is the vagus, the 11th cranial nerve, that is the spinal accessory nerve, and the 12th cranial nerve, that is the hypoglossal nerve. Also, it contains two pairs of lymph nodes, which are the jugulo-digastric node and the jugulo-omohyoid node. Now we will look at the carotid sheath in detail, which is also a content of the carotid triangle. It is a condensation of the fibroareolar tissue around the main vessels of the neck, which include the jugular vein and the carotid arteries. It is formed anteriorly by the pretracheal fascia and posteriorly by the prevertebral fascia. Contents of the carotid sheath include the common or the internal carotid arteries, the internal jugular vein, and the vagus nerve, which is the 10th cranial nerve. Some parts of 9th, 11th, and 12th cranial nerve also are present in the carotid sheath. Looking at the relations, the ansa cervicalis is embedded in the anterior wall, and the cervical sympathetic chain is related to the posterior wall. Here you can see the ansa cervicalis on the anterior aspect and the sympathetic chain on the posterior aspect. Finally, we look at the clinical aspects. The carotid sinus syndrome is a condition in which the carotid sinus is hypersensitive and sudden rotation of head causes slowing of heart. In cases of supraventricular tachycardia, carotid sinus massage can be done to cause the slowing of heart. Next, necktie should not be tied very tightly as it may compress both the internal carotid arteries which supply the brain. In cases of conditions of deep cervical lymph nodes, they become adherent to the internal jugular vein. Then the sheath has to be exposed and portion of the vessel, that is the internal jugular vein, is cut to help the removal of these lymph nodes. I hope you liked and enjoyed this video. Please give your suggestions in the comment box down below and help me improve this channel. Thank you for watching.